Hello everyone to sqadia.com. My name is Osama, and the topic we are going to talk about today is the musculoskeletal system. This section of the musculoskeletal system is about the diseases of the skeletal muscles. So let's start with the outline. In this section, we will learn about muscular dystrophies such as Becker and Duchenne muscular dystrophy, myasthenia gravis, postural syndromes involving different muscles, and myositis. First of all, we have muscular dystrophy. Muscular dystrophy is a group of disease that causes progressive weakness and loss of muscle mass. There's not much that we can do to prevent it because it has a genetic predisposition as well. It is actually caused by an abnormal DJD gene, which is the largest gene in the human body. Due to abnormal DJD gene, there is either absence of dystrophin, decreased presence of dystrophin, or abnormal dystrophin. The question is, what is dystrophin? Dystrophin is actually a protein which is an integral component of a skeletal muscle fiber or a striated muscle fiber, which connects the cytoskeleton of a skeletal muscle fiber to the extracellular matrix, in the absence of which the muscles cannot perform or function properly. And as mentioned here, in muscular dystrophy, abnormal genes, which is an abnormal DJD gene, interfere with the production of protein, and that protein is dystrophin. And in the absence of this, then there are abnormal muscles and abnormal manifestations of the muscles. Now, due to this absence or either decreased levels of dystrophin, we can have two different types of muscular dystrophies. If there is severe deficiency of dystrophin, or if the dystrophin is absent, then the disease is known as Duchenne muscular dystrophy, as you can see here. Now, Duchenne muscular dystrophy is a more severe type of dystrophy, and the signs and symptoms start to appear as early as at the age of 2 or 3 years. A very special clinical manifestation or a symptom of Duchenne muscular dystrophy is Gowers' sign. To elaborate Gowers' sign, we have shared with you here a picture. Here you can see, unlike a normal person or a child, the child is not able to stand up properly by giving force on his knees and quadriceps muscles. Because of the absence of dystrophin, the quadriceps muscles are weak, and to help the quadriceps muscle, the child has to use his or her hands to push the knee joint, so that helping the quadriceps muscles in performing its function, and that it appears as if the child is using his or her hands to climb his own body to stand up. Other than that, there is a severely disturbed posture, very much increased lumbar lordosis, and there's also fibrosis of the muscles as well. And in a very small age, the children or the patients with Duchenne muscular dystrophy become wheelchair bound. The Becker muscular dystrophy, on the other hand, is a less severe form of muscular dystrophy. It is also because of the decreased levels of the dystrophin, but this is not as severe as the Duchenne. So as it is milder, it also progresses more slowly. Symptoms generally begin in the late teenage or early teenage, or even in the mid-20s. On the other hand, as we saw, that Duchenne muscular dystrophy manifests its symptoms as early as 2 to 3 years of age. Now, one very important thing about Duchenne muscular dystrophy is that the DJD gene, which is responsible for the production of the protein dystrophin, is X-linked. So that is why it has a different manifestation in males and females. So as females have 2 X chromosomes, they can either be carrier, they can either be normal, or they can either be affected. But in cases of males, there is no chances of being a carrier because there is only one X chromosome and the other is Y chromosome. So the presence of Duchenne muscular dystrophy, or the chances of presence of Duchenne muscular dystrophy, are pretty much greater in males as compared to females. As you can see here in the example, the father is normal and the mother is normal as well, but she's actually a carrier. But being a carrier, she doesn't seem to have the symptoms of muscular dystrophy. But the child, even though that father is normal, the child will have the Y chromosome from the father and X chromosome from the mother. So if the child receives the infected or the affected or the abnormal X chromosome from the mother, even though the father and mother did not have muscular dystrophy, the child will have muscular dystrophy, and the patient will have symptoms as soon as 2 years of age. And here you can see increased lordosis, and here you can see at the age of 15, the patient is wheelchair bound, and another manifestation due to fibrosis, and which is known as the pseudo hypertrophy of the calf muscles. They seem enlarged. It doesn't mean that the patient or the child has strong calf muscles, but it is usually pseudo hypertrophy. And on the other hand, when the child sits, this lordosis disappears, and when the child is in the standing position, the lordosis increases. The second condition that we are going to talk about is myasthenia gravis. It is an autoimmune disorder, and like all of the autoimmune disorders, the body develops white blood cells which actually activate against a person's own tissues or normal parts of the human body. So as WBCs are activated against the neuromuscular junction, then it manifests as myasthenia gravis. What is the neuromuscular junction? Neuromuscular junction is actually the site where the motor neurons terminal joins the muscle, because the messages from the nervous system are transferred via this synapse or neuromuscular junction to the muscles in order for them to contract. In the myasthenia gravis, there is destruction of this neuromuscular junction and also muscle-specific receptor tyrosine kinase, which are actually involved in the production and the upkeep of these synapses or neuromuscular junctions. So once these neuromuscular junctions are destroyed, what happens is that the message from the nervous system is unable to be delivered to the muscles, and thus contraction is not possible. And as more neuromuscular junctions become involved in this condition, then there is a progression of this condition with progressive weakness. And as less neuromuscular junctions remain, so there is rapid development of fatigue as the time surpasses. It is also observable in enlarged or overactive thymus and thymomas. Thymomas are actually tumors of the thymus. Now, postural syndromes, it is not obvious that the condition may be genetic or autoimmune. The conditions may also be mechanical, such as the most common condition or the most common cause is the poor posture. The poor postures can be of different types depending on the number of muscles involved, the type of muscles involved, and which muscles have become weak or inhibited, and which muscles have become shortened. The muscles which are prone to get weak are usually the muscles which maintain the posture, which are known as the stabilizers. And the muscles which are prone to get short are usually the mobilizers. Here you can see there are different types of postures which are mentioned. One is the upper cross syndrome, which is a very common posture, also known as the forward head posture or text neck, in which there is weakness of the middle trapezius and scapular stabilizers such as rhomboids, and also weakness of the deep neck flexors and lower trapezius. On the other hand, there is shortening of pectoralis major, cervical erector spinae, and upper fibers of the trapezius. On the other hand, there is the lower cross syndrome, which results in anterior pelvic tilt and shortening of the iliopsoas muscle and lumbar erector spinae, and weakness of the abdominals and gluteus maximus. There are some people in which there would be a combination of both upper cross syndrome and lower cross syndrome. That posture is known as kypholordotic posture, with increased lumbar lordosis and increased thoracic kyphosis as well. In the flat back posture, there is decreased lumbar lordosis or flattening of the lumbar spine, accompanied with posterior pelvic tilting. In the sway back posture, there is reversal of the lumbar lordosis with accompanied posterior pelvic tilting. In the layer syndrome, there are different layers of muscle. One layer is shortened or hypertrophic, and one layer is inhibited and lengthened. Handedness posture is a very common posture which is present in most of the population because of asymmetry in the left and right hand side. For example, if I am having a handedness posture, so I am having this posture because I am a right-handed person, because I use my right side or right extremity, right upper limb, right hand, right shoulder more as compared to the left one in different activities, which results in a sort of asymmetry. But this is usually not considered as an abnormal posture. Another condition is the myositis, which is actually the inflammation of the muscles. The cause for this is usually idiopathic, and polymyositis is a condition in which different muscles or more than one muscles are involved and they are inflamed all over the body. There's a similar condition which is known as dermatomyositis, which also has its manifestation on the skin, like rashes and red spots. And there's also an inclusion body myositis, which is a very rare condition. Now we're going to talk about mechanical causes of pain in muscles, because it is not obvious that there would be any sort of disease. But these are some types of conditions which are experienced by a lot of us in our normal and daily lives. One is the tendinitis. Tendon is the structure which joins the muscle with the bone. And due to abnormal or biomechanical stress, or due to overactivity and repetitive stress, a person may develop inflammation of the tendon, which is known as tendinitis. Common examples of tendinitis are medial epicondylitis, like golfer's elbow, and lateral epicondylitis, also known as tennis elbow. Then there is tendinosis. Chronic tendinitis with recurrent episodes then developed into tendinosis, which is a chronic condition as compared to tendinitis, which is an acute condition. Then there is one sensation and one problem in the muscles which is experienced by all of us, which is muscle spasm. Whenever any muscles becomes overactive, either due to muscle guarding or pain, then that is known as muscle spasm or cramp. And muscle fatigue is also a normal phenomena that all of us experience, and it is usually because of accumulation of the lactate, which irritates the free nerve endings and causes a sensation of diffuse aching pain. Tumors of the muscles include leiomyomas, rhabdomyomas, and rhabdomyosarcomas, but we are going to talk about these in the detailed section of soft tissue tumors. So the topics that we have covered in this section of the musculoskeletal system included muscular dystrophy, myasthenia gravis, postural syndromes, and myositis. I hope you learned a lot from this lecture, and please stay tuned for the next part, which is the disease of the bones. And thank you for watching, and keep watching sqadia.com.